I think the word that represents my childhood is abandonment.
What patients have to say about you is always awe-inspiring. You are able to bring about fantastic clinical results and work at the highest level I've ever seen within functional medicine. So how did we become such an amazing functional medicine practitioner?
I was born to very emotionally unavailable parents. My story includes physical abuse, it includes sexual abuse at a very young age. And without knowing what I was doing, I was abandoning that need for needs. I abandoned myself in that journey in order to survive. But I was also lost in shame and feeling that I had deserved what I'd gone through.
Yeah.
What happens to most trauma victims is they spend the rest of their life in that trauma cycle. In order to reclaim those abandoned parts of myself, I had to look each one of them in the eyes. That is my true authenticity. People feel me through the work that I do.
This is such a clear story of how someone goes through the deepest level of adversity and finds their way to healing and wholeness. So today we have with us the most amazing Jo Gamble. Anyone in our field of integrative and functional medicine will know Jo well, very well. She is an international speaker, lecturer, national speaker and lecturer. You basically teach all the doctors and all the natural therapists, nutritional therapists in the field of functional medicine, having been the first officially certified functional medicine practitioner in the UK back in 2013. Yeah. So you work at an extremely high standard. You've seen thousands of patients over your time. I work with a lot of the same patients. You refer to me, I refer to you. So we work quite closely in tandem together in clinic. And what patients have to say about you is always awe-inspiring. So you take people on an incredibly deep healing journey. You are able to bring about fantastic clinical results for patients and work at the highest level I've ever seen within functional medicine. So all of us all go to Jo all the time to ask clinical questions and solutions, and you're always very ready to help and guide. So how did we become such an amazing functional medicine practitioner? This is something we're going to examine a bit more today. And it is such an incredible honour to be able to have you with us today and for you to be willing and happy to actually share your personal story. So a lot of people in the field may have heard your professional story with some personal in it. You've spoken quite openly about your daughter's illness and your journey into functional medicine. But actually, you've never shared your truly personal healing story. So, and for me, this is such a clear story of how someone goes through the deepest level of adversity and finds their way to healing and wholeness. And that's what's so incredible about your story, is through adversity, we can either sink or swim. And you're someone who really learned how to swim, and not just swim, but also thrive. But in that process, some parts got left behind. And through realizing that and the recognition of that, you then went on a journey to essentially piece yourself back together again. Now, we met a couple of years ago, only a couple of years, it feels like a much longer, but we met a couple of years ago on a professional level. And when we started speaking, I think it was like the second time we met, it was only over Zoom, I suddenly got the very intense feeling or knowing that there was so much pain inside. Like I could feel so much pain from your face. And I remember, obviously I had to ease into that. I wasn't just going to, share that. I barely knew you at that stage. But we started speaking a little bit more, and I remember you almost falling off your chair with shock and almost horror that I could read through and see past your mask, is what you said. You said, well, how could you see through that? I wear this, strong professional mask. You're not supposed to be able to see that. And, that began a journey for both of us. And you began to enter onto a deeper journey of trauma therapy and healing, and what has been so awe-inspiring and such an honor to bear witness to over these years is how you have moved through each stage so courageously, but also so quickly. That's what's always just stunned me about you, Jo, is you've moved through all these different levels of healing in such a short space of time. So back then, when you first started, when I started witnessing you entering onto this really deep trauma journey, I knew that one day you would tell your story to the world. I knew it, just had a knowing. And how many people you would help through that process. Be able to inspire people that have been through similar levels of adversity in their childhoods, to actually give them hope, to say, look, what is possible. But I never imagined it would happen in such a short space of time, just 2 years. So it's really, really a big, big deal, obviously for both of us, but particularly for you and for anyone watching who maybe knows you, or even those that don't know you, to see that you're willing to share this story only 2 years into such deep trauma healing. Now, you did touch on you did some therapy some years ago, and you did sort of open things up. You did go back to the past and look at what had been present, look at what you had been through as a child. But actually you decided to put the lid on that because you didn't feel you were getting very far with it, and it was creating more problems than solutions. So we'll come back to that as part of your healing story. But to begin with, like I said, you're working this extremely high level in functional medicine. I mean, it was only recently you were in a conference and you were introduced as the best functional medicine practitioner in the UK. I know you would never say that about yourself, but that's how the rest of us see you. You're working at such an incredibly high level. Like I say, teaching all the doctors. Without being a doctor yourself, you've achieved this extremely high level in functional medicine. So maybe we can go straight back to your early beginnings and talk about that story of adversity. What actually happened to you? And then the impact of that on your adult life, and then how you found your way through healing, what healing you have found, how you found that way back towards wholeness and integration.
Okay, let's do this. So I think the word that represents my childhood is abandonment. And that abandonment, I honestly think, began the day I was born, when I was born a girl and my mum very clearly wanted another boy. And I was born to very emotionally unavailable parents. And I was born to save their marriage. I came after 3 miscarriages to my mum, and I was the last ditch attempt to A, have a child, and B, save their marriage, which I wasn't successful at anything that I was sort of set out to be, other than I did survive. And that abandonment saved my life. But it came at a cost. It came at a huge cost.
What do you mean your abandonment saved your life?
Because it stopped me feeling, and it was the first way that I could manage needs. As a young child, you can't leave your caregivers. You can't run away physically because there's nowhere to run to.
You can't survive on your own as a baby or as a child.
No. So I very quickly learnt, before I have any memories of learning anything, that the way to survive this life was to not have needs, was to not experience or have the feelings of what most children would accept without awareness as just basic fundamental childhood needs like love and joy. I very quickly realised that that was not going to be my story. That was not going to be my childhood. And I don't have memories. And despite doing many a journey of psychotherapy into, surely there's happy memories in there, Jo, they actually aren't really there because they didn't really exist. And my story includes physical abuse, it includes sexual abuse at a very young age, and it also includes having very emotionally unavailable parents that had bigger needs from me than I could ever have from them. And without knowing what I was doing, I was abandoning that need for needs in the knowing that if I didn't need to feel love or joy, there was no disappointment. There was no failure. So I numbed myself through my childhood because I couldn't run, I couldn't fight. So I abandoned myself in that journey in order to survive. And that's what I did.
And the reason this is such a huge deal today for you to share your story with the world is that actually when we met 2 years ago, you couldn't at all, could you?
No.
And it really took some time and some therapy for you to be able to, and you know, we grew quite close quite quickly as friends, and you trusted me quite quickly as friends, but it's still within that process was very hard for you to tell me what had happened because you were so used to not sharing. You never trusted anyone, I guess.
I didn't trust, but I was also lost in shame. And there was elements of being lost in guilt and feeling that I had deserved what I'd gone through.
Yeah.
So in being lost in very toxic shame, I didn't want to share that story because it was easier to give the pretense of this powerful woman that I had become. And people, both professionally and personally, would see my, 40-whatever-year-old self standing forward when we met and feel that I was a powerful woman, feel that I was a strong woman, feel that I'd got it together. And actually, I didn't want to change that persona because it was easy to wear that mask, that professional and personal mask of I'm okay.
Yeah.
Because it was very painful to take that mask off.
Yeah. And something you always, a part of your identity that I felt you really held on to was, I'm strong and I'm independent. Because that's what you had to become to not just survive, because this is a story not just of survival, but of actually thriving. To become the best functional medicine practitioner in the UK in the era of functional medicine that we're in now is no small thing. It's no mean feat. So to be able to tell this story now, mask off, and to inspire people who have been through similar levels, deep levels of adversity and trauma in childhood, who have also felt that shame, who have also felt that guilt, who have also been in hiding, keeping that mask on, because as you say, it's easier, it's more comfortable, and who are you going to trust with the real you anyway? Because actually, whenever you had been that vulnerable self as a child, it was taken advantage of.
Yeah.
So I know, you're not going to want to go into graphic detail because the story itself is very graphic. But maybe can you give an indication a bit more as to what happened? Who were who the perpetrators? What actually happened to you? What was so bad? You talked about the lack of love, the lack of joy. There was certainly neglect, significant neglect in your story, emotionally and physically.
So both my parents were caught up in their own trauma journeys, and back in the day they had no coping strategies. My dad was an alcoholic, a very functional alcoholic, a businessman, but nonetheless an alcoholic. And my mum, who had been through a really traumatic life, had horrendous OCD. And the focus of her existence was coping with her OCD with very little equipment available to her. So, we can only work with the skills that we've got, and neither of them had skills. Neither of them had skills to address either of their own clearly deep trauma stories. So they continued what they knew best. And that is the case of most trauma victims, is they reenact and they mirror their own trauma story. So in the defence of both of my parents, they didn't have skills beyond merely reenacting what had happened to both of them. So neither of them was able to protect me, either from the other person, because I received quite deep trauma from both of them.
Your mum emotionally.
My mum
your dad
emotional,
more
absently,
sexually.
absent, physical, emotional, she wasn't present. And my dad more on a physical and sexual level. And
this was throughout your childhood, wasn't it?
yes, as far back as my memories go.
From age 3 it began with your dad.
So because of that level of deep kind of exposure to trauma, I found my own way in the world, my own coping strategies, my own way to deal with isolation and abandonment by really reenacting what others did to me, to do it to myself. The difference is, nobody intervened, no teachers, no caregivers, no anybody. So I survived through adversity by almost being my own, as I got older, my own perpetuator of that trauma, because I didn't want people to get close to me. I didn't know how to accept love. I learnt to give love because I have children, but I certainly didn't know how to receive love. Because again, we're not taught those things. We're not taught, particularly those of us that have been through deep, deep, deep trauma journeys, we're not taught how to kind of regrow from that trauma. So actually what happens to most trauma victims is they spend the rest of their life in that trauma cycle. Many go into, and I certainly have, gone into addiction cycles, and that's saved me at times. Many people reenact what their parents went through, and many people die.
I know. I've always said to you, your journey, your story means that you should probably be either dead or an alcoholic or a drug addict by this stage in your life. So many would.
Drug addict for me was never the option because my need was control. So I did entertain that one. But I very quickly realised drugs were not going to be my journey. Alcohol, I've got a very addictive personality, which I have channeled into a work addiction, which I still have had to really work on. Alcohol was definitely something. I went on to marry a functional alcoholic, which again was that kind of mirror part of marry a person that's not dissimilar. He was definitely didn't reenact the physical elements to it, but I married a functional alcoholic, and sometimes they say you can't beat them, join them. So I had that sort of for many years over use of alcohol, which I very quickly was like, I could be my father. I could become an alcoholic, not an alcoholic on a bench. I could become a functional alcoholic because alcohol gave to me the escapism. Very short-lived, but that's what alcohol could give me, the kind of let's numb the brain and let's get out of the body. I mean, I didn't want this body. I couldn't be in this body.
Because the body had been such a place of pain all of your childhood.
Yeah. So for me, it was eating disorders. That was where I kind of went for safety and went for, which sounds pretty ironic, I know, but it was where I went for numbing. Because, like I said to you, I couldn't fight. I couldn't flee. So the only way to survive was to numb.
And you were silenced as well.
Yeah.
You know, you were told, if you tell anyone, I'll kill you.
Yeah.
So, talking wasn't an option.
No.
Did a teacher at one time try to ask you something? I can't remember. Is there something someone tried to reach out?
I think there was a time a teacher asked me something that could have suspected, but it never went any further because I didn't talk.
Yeah. So silence from a young age. And even with the physical abuse, where there were steel-capped toe boots taken to your ribs and things like that, it was, you weren't taken to hospital.
No.
You had broken bones. Yeah. And obviously with the sexual abuse, you presumed that was known about within the home, but nothing was done about it. So there's this real kind of silencing of everything. And we suspect that's where the guilt and the shame comes from, because actually when our primary caregivers tell us, well, this is the way it's supposed to be, and actually, for you, it was terrible, then the perception then comes, which is, well, it must be my fault. It can't be their fault. They're the adults. They know better than me. It must be my fault.
And that's certainly where the guilt came in, that I must have deserved that. Whether it was because I was a girl and I failed, or as I became older, I was the younger sister to a very bright brother. I could never meet the expectations put upon me by family.
And that was a really core belief that you've worked through over these years, isn't it?
It's only just.
Feeling you're stupid. And
yeah.
Ever since I've known you, I've always said how incredibly intelligent, and you have such a fast processing speed, and you hold so much information in your head, which one of the reasons you're so amazing at your job. And yet still you've had this underlying limiting belief that you're not clever enough. So you've been having to unpick that. And actually we even did an IQ test, didn't we? And it was very high. 140 or something, wasn't it? So in the gifted range. So actually when you go back and talk about, I was a sister to a much brighter older brother, that actually probably wasn't true at all. No. I have a daughter who's incredibly intelligent as well. So the intellect is high in your genetics, in your family, but you were made to feel like you weren't intelligent and that you were stupid, and that's a label you wore for yourself for a long time.
Yeah, it's a label that I still need to remind myself I don't need to carry.
No.
But I think for me, the biggest emotion is shame. And it's not just shame. I was once taught that shame is like cholesterol. You've got the good stuff and you've got the bad stuff. And I was caught and still will say in toxic shame. That core belief that not just that it was my fault, but I deserve this. I didn't feel that I was allowed to feel those feelings of love and compassion, and they just weren't on my radar, Anna. Not any of them. None of them.
You know what I always thought was amazing about you was how you could be such a wonderful mother and give so much love and attention and care to your children, having not been modelled it yourself. I mean, how do you explain that?
I honestly don't know. I have two wonderful girls and I love them both with every bone in my body. I don't know. When I was pregnant with George, I was only 22, and I just knew. I actually didn't think I would. In fact, for neither of my girls, I think they're both miracles, because having gone through really quite significant eating disorder behaviour and big parts of my life, I was in amenorrhea, absent periods. I think for me, actually looking back, anorexia, which saved my life, it saved my life, but it also kind of took away my femininity that I was not okay with. I wasn't, having gone through sexual abuse to then be in a kind of intimate relationship and think that was acceptable was really hard. So I wasn't convinced I was ever going to be fertile. So for my eldest at 22, it was such a blessing to get pregnant and to hold on to that baby. And every day I put my hands on my tummy and was like, oh my God, I'm going to love you like I was never loved. And believe me, I did that. You know, I had to fight for that little girl.
Good.
She really, really took my fighting to the nth degree. I couldn't fight for me, but I could fight for her. And then my little one, I have a, you know, big age group, a gap between my two children. Actually, I went through adult anorexia, and I put strain on my heart. And again, I went into amenorrhea for 5 years. I stopped having periods. So the thought that I would ever be able to have another baby, to carry another baby, was just unthinkable.
It's incredible.
So when my little one came into the world, it was like the biggest joy and honour to be able to welcome her into the world. So to me, both my children are miracles. Every child are a miracle, but both my children are special little miracles.
I mean, I would say it's either just your natural essence in terms of the love you've been able to give your children and your patients and your colleagues. Like, you have so much love to give. So it's either just your natural essence. I'm sure that is a big part of it, but maybe it's also how one extreme breeds another.
I think I remember when I was pregnant with Georgia going, I'm going to be different. And I didn't know what different even looked like, because being so young, I didn't have role models. You know, I couldn't.
You were how old when you had her?
22.
Yeah.
And, you know, for most parents, they model a lot of their parenting on their parents, don't they? I'll parent like my mum, or I'll take bits from. I read all the books, but I just went in and knew that I had to be different. I had to break the mold.
You were a cycle breaker.
Yeah.
So sometimes in families we have someone that comes in and breaks that cycle.
That was
and
me.
You did that. So when you said that anorexia saved you, what do you mean?
So anorexia, my anorexia journey was not what a lot of people perceive as an anorexia journey. So my first, in fact, all my memories of food, way before anorexia, were choking on food, food getting stuck. You know, I have memories of feeling the pain of swallowing. And it wasn't a physical pain. It was an emotional, like trying to swallow things down or bringing back up, rejecting those emotions. So actually, as a young child, I cut certain foods out. I really struggled to eat bread. I really struggled to eat potatoes. Interesting, my dad's business was based around potatoes. So you know, that became something, I guess I associated with a lot of pain.
And
so
food, the swallowing was part of the mirroring the sexual abuse things. Yeah.
So I have lots of childhood memories of struggling around food. But really my first memory of the challenges of food came when I was 14 years old. And my dad died when I was 11. And I was 6 weeks into starting high school. It was 12 weeks before my 12th birthday. And I was told that he had been taken ill and was in intensive care. After maybe a few days, I was told he'd died. I remember the day. I remember what I'd ate for dinner that night. I just ate my dinner when the phone call came, and it was actually my nan that told me that my dad had died. I went to school the next day, and I was left to behave quite normally, that my dad had gone. I went to his funeral. My mum took me. She cried. I cried. My brother cried. That was the end of it. Dad was gone. We don't talk about it. And then when I was 14, my mum was in therapy for her OCD, which had continued to be a huge part of my existence, was her control and me constantly trying to be better to fix her OCD.
For her.
My brother challenged her on it. I never did, because I just felt that if I was a better behaved child, then life would be easy again. But it never was.
And you had to get locked in your room, didn't you, to make it easier for her to deal with it?
Because of how her OCD was, it was that came first and foremost, before me and anything else. And then one night I was 14 and my mum put my dinner on my lap in front of the TV. It was Coronation Street. I remember it well. I remember what the food was. She was in therapy at the time and she said, "I've got something to tell you." And just like this, she said, "By the way, your dad committed suicide. Anyway, eat your dinner and watch Coronation Street." And it felt like such a deep stab in my heart, because he chose to die. And now, 3 years later, I had no answers to the questions as to why he chose to die and what he was gaining from leaving the planet through choice. And then a mixed bag of emotions came up. Like, "I can't believe you've done that to me, to my mum, and I hate you to my dad, because you left the planet and you chose." But I silenced and I swallowed the emotions with my dinner, and then I vomited. And that was my real first kind of real memory into where my eating disorder came from. And I played, as many youngsters did that look like bulimia? I was never going to be a binge eater, but I found a comfort in vomiting. But anorexia for me was not the perception, and I think for many trauma victims, the perception of, I want to be skinny because I want to look like that model, or, nowadays for youngsters, that person on social media. That was not my eating disorder behavior. But eating disorders were a huge part of my kind of formative years. And, I went through the motions of losing a lot of weight and then going into refeeding programs, which is very much about exactly what it says it is. We get your calories back up with no explanation. And in my younger years, there was no touching on why. But I thought when I met my husband and I had my little girl, I could swallow my eating disorder behavior. And I did for many years. I still had that kind of tendency towards, not when I was pregnant, but then, it was easy to drop back into. And for me, alcohol might have just been a couple of glasses of wine every night. It wasn't a drink. There was no drinking in the day. But there was that I can get to 5 o'clock and I can have a glass of wine, which many people do that as a means of kind of ending their day.
Instant relaxation.
But it was also an element of don't feel. And actually I feel blessed that I met a man that never put any kind of sexual strain on me, whilst my ex-husband couldn't give me the emotional support that I needed. He also didn't put any sexual
pressure.
Yeah. But for me, being in an intimate relationship, I had to have a drink before I had sex, which, again, is not unnormal. So that's how I became normal in kind of a...
Managed it.
Yeah.
With whatever you could. And
then came my first psychotherapeutic journey. And it started when I'd had quite a lot of out of control with my daughter's health. And then I tried for another baby. I had a miscarriage. I then kind of didn't even realize what was happening, that I went back into in the way I knew best, controlling an out of control situation. And before I knew it, I was back in full-blown anorexia. I was 27, 28. I had a 5-year-old. I was behaving really normally by day, taking my daughter to school, working, but I was in so much pain. And the way to release the pain was to inflict more pain on me, because again, that's what I knew best. So I went back into self-harm. I went back into anorexia. And believe me, there was no attention seeking. Nobody ever saw where I'd hurt myself.
Hidden.
It was hidden.
Secrecy.
And it was a way to try and release the deep pain that actually starting psychotherapy brought up. Because that was the age I very first told anybody what had happened to me.
This was what age?
I started that journey when I was maybe 27. And I told my therapist that I had been sexually abused. And I had an amazing psychotherapist and body psychotherapist, but it wasn't enough. It wasn't enough to hold what was going to spill out. And the only way to kind of contain that pain as it came up was to go back into a behavior that had been almost comforting.
The self-harm.
Yeah, the self-harm and the anorexia. And before I knew it, I was back at a level where really an inpatient unit was needed. But I had a 5-year-old and had a 5-year-old that had very high needs. So
She was really unwell.
She was really unwell. So I begged the psychiatrist, please, can you leave me in society? Like, keep me.
The community.
I need to do a community-led program. And he said, you can't because you're self-harming. And he said, you have to prove that you can stop self-harming. You need to be 6 months free of self-harm before you can go into a community-led program. Do you know what that meant? That the NHS gave me nothing for 6 months.
You were on your own.
I was on my own.
Again.
And I was back into kind of, okay, so I can't release the pain, which is what
The
self-harm did.
gave you, yeah. Like a distraction.
Yeah.
The psychology of self-harm was like, create pain here, so I don't feel it so much here. This distracts me from the pain inside.
And it worked for a very short period of time. It worked and the pain eased, but that got taken away from me. So I learnt even more to numb.
Which was the anorexia
Which
part.
was the anorexia part and the not having feelings.
Because you disconnect from your hunger signals, you detach from your body, and so therefore that also detaches you from what you're feeling inside, I guess.
Completely. And it takes you out of this physical body that hurts so much. So I spent the next 6 months, I was already a really low weight at this point. I was supposed to weigh in every week with a nurse, and the first week I think I gained 200 grams, which, you know, in anorexia is quite a big deal. And she said, well done. And I was like, you patronising bitch, I'm out of here. And that was me going, I'm not going back into kind of that. I can't do that.
What was so that people understand, what was so wrong about her saying well done?
Well, it felt so...
Didn't she say good girl?
Yeah, good
Isn't it like
girl.
that, good girl? So it's more like speaking to a child.
It was, and it was that, like, you don't understand that why it was easy for me to not feed. And actually I felt a failure to feed myself. I felt like I was failing myself by gaining weight.
I see. So that was the kind of the conflict set up. So you saying well done and good girl, that's not my experience. You just don't understand.
And always in deep shame, toxic shame. Any positive emotion is a juxtaposition to a negative emotion. Like, the joy means that I'm showing myself to the world, and love means I'm feeling something. So my way of dealing with that toxic shame was to not feel. So I didn't want to feel food in my tummy. I didn't want to feel.
So that connects you back with your body every time.
And I hated it. I hated it. But you know, through the whole of that journey, I still showed up at work every day. I still sat in consults, and I still tried to be that practitioner to make a difference. I stood on the stage. I felt like such a fraud that I was lecturing as a very low weight anorexic, and people thought I was wonderful. People thought I was so powerful, and I felt like such a fraud.
More conflict.
More conflict. More conflict. Just to add to the conflict, I remember my mum saying to me, "You're making me ill because you're so skinny." And I watched my husband at the time drink more because he couldn't deal with it. I watched my friends feel that they weren't good enough because they couldn't reach me. Thankfully, my little one was still too young to really appreciate what I was going through. And that was a blessing. It was such a blessing. Anyway, I made it. I made the 6 months. I had to prove that I wasn't self-harming. I had to be body checked, and I made it into the program, which was a 40-week, twice a week psychiatrist, psychologist community program where you had to be weighed in. And it was all about refeeding. It was how many calories have you eaten? How can you eat 3 meals a day and 2 snacks? And how do you hit your personal goals? I got refeeding syndrome. I gave myself osteoporosis. I damaged my heart, which thankfully I've healed. I actually reversed osteoporosis. But I gave myself some pretty physical impact. And at that point where I'd been trying for another baby, I knew that that was the end of my ever being able to have another baby. So I thought. So I went through the program. Not once really did they touch upon, again, the root, as well as group work. You did one-to-one with a psychiatrist. You did one-to-one with a psychologist. And I never told my story.
You never did, even in that time?
Never in that time. So I was working with my private psychotherapist, and then I got a diagnosis. I don't want to say it's my diagnosis, not my diagnosis, of complex post-traumatic stress disorder. That was my first real exposure to reliving the trauma and flashbacks. And obviously they offer medication. I didn't want medication. I didn't want anything in me that would make me feel less than in control. So I went through, it took me 5 years. So the difference between community programs and inpatient is it was a long slog to kind of get back into some sort of relationship with food. But I did it. I did it. I hit my weight again. But with that, I went back into hating my body, not because it was about what I looked like in clothes or in front of the mirror. I actually didn't look in the mirrors. And I've been banned from using weighing scales from that day forward. But why I hated my body was because when I put food in it, I felt.
Yeah.
And I didn't really want to feel. So that day I put on a mask, and I don't think it was conscious, but it was a way to end that chapter of my life. It ended my marriage, and I moved forward. Definitely leaving, or what felt like leaving the anorexia behind, but the cost of wearing a mask was the hardness of not feeling, the hardness of, I felt my daughter's love, but the hardness of connecting with the world that we live on. That was what was hard. But the mask saved a lot of the pain. So that's what I was prepared to do. Threw myself into my career, threw myself into a second marriage. I threw myself into IVF for my little girl, and pregnancy and breastfeeding.
The marriage that followed.
Yeah. And then came kind of where you came into that story, and the again, once more, having had a baby, she was 2 at this point, kind of going, how do I find me again on this journey of having been a mum and breastfeeding? I know I'm going to do a master's. So I signed up for a master's, because that's what I do, is I I go for the next academic qualification, and my very long list of letters after my name didn't quite fulfill me. I'll go for a few more. But we kind of both knew that was just another coping strategy, albeit really socially acceptable, really socially acceptable.
Lots of ticks, lots of approval, well done, praise, proving yourself, as you've said, the self-worth, regaining some of that. And it's actually very common, isn't it, when someone's gone through a lot, to not want to connect with the body anymore. So where do we go? We go into the head.
Yeah.
So we keep developing and overdeveloping the intellect at the cost of the connection with the body.
But also maybe at some point when I've done enough qualifications, I would not feel a fraud, because I always felt like I was stupid. So, surely at some point I could prove myself that I wasn't stupid by getting more qualifications and getting more, I don't know, internal kind of belief system. So that led me into what I will now describe as my true healing journey. It led me into what has been a roller coaster over 2 years of therapeutic intervention. The first therapist I worked with, who sadly is not on this planet anymore, I lay on her bed and she used a combination of muscle testing and intuition, and sat there and said, what happened to you at 4? I was like, oh my God, she's on point. What happened to you at 17? I was like, I didn't tell you that. I didn't tell you that story. So how did you know? She's like, no, you need to tell your story. And that made me open up about my second period of sexual abuse in my life. Another known abuser, somebody who added to the, you deserve this, Jo. You, because of the person that you are, you deserve to be hurt. So why would I ever question that I wasn't? That was, I don't know, just as painful, if not more of a painful experience of kind of sexual and emotional, real deep emotional abuse, that I once again had to, that time, run away from, flee from, and numb from. And that experience, which I didn't share with anybody.
Took you months and months before you could share that part of your story with me.
And the consequences of it. And I got pregnant in that journey, and I aborted the baby, which brought with it so much guilt.
He had taken you to the abortion clinic each time.
And I never thought I would tell that part of my story. And that part triggered deep PTSD, deep flashbacks, deep, real complex trauma story.
That's in your sexual development years, isn't it? The 17.
And actually, again, how I survived that is I went into anorexia, which took me into amenorrhea, which took me into kind of almost like asexuality. Like, I'm not a woman. I don't own this body. I can't feel this body. And like I said, the only way that I could come out of that was and go into a sexual relationship, because at that point I was 17. I'd never consensually had sex with anybody. The only way to go into a sexual relationship was at the very beginning, get paralytically drunk, and then kind of as my marriage went on, well, at least as long as I drank a bottle of wine, I'd be okay to have sex. And she called me out on it and was like, you need to tell this part of your story, because you can't heal by owning half of your story or none of your story, which was the truth. So during this period of time, this 2-year kind of therapeutic journey, I brought in every type of emotional kind of crutch to help me. I've done a lot of semantic therapy, which even that took me back into the depths of trauma, like seeing the visions and using the tools to take the power out of them. But it didn't take the power out without me seeing the level of trauma that I had gone back into. So much so that I didn't know I was going to even survive this. I was like, that's why I put the lid back on it. It before.
Was too much.
This was a lot. out. And I drew upon, first of all, every part of inner strength that I had in me, and really from the external world. And I don't know, gritted my teeth and went on that journey where, in order to reclaim those abandoned parts of myself, I had to look each one of them in the eyes. And I had to see every part of the memory and why I'd fractured all of those inner parts of me off. But in awakening to it, I felt for the first time, and the pain that came with that feeling was unbearable. It's the first time in my life I'd ever experienced depression, as opposed to only ever experiencing anxiety, because actually depression is a feeling. And I'd never experienced it, and then it engulfed me. And the pain of what I'd been through engulfed me.
Having to look it in the eye.
And I really went deep into my spiritual journey to connect. Because in order to heal, I had to come back into my body. I'm now 44 years old, and I had never embraced this feeling. I hadn't. And for the first time, I had to reconnect with it. And that's not something kind of conventional therapy really hadn't set me up for, was that as I came back, it hurt. And it hurt like pain I'd never felt in my life. But I knew I had to feel it. And I went past the point of no return. Because at the beginning, I was like, I can stop this. And then I realized there was no stopping it, because I was part in and I was part out. It's like having a baby and the baby's half out of you and you're like, I'm done. And you know you can't. That baby's got to come out. And I felt I needed to come in. But I had to dig into it was the biggest journey I'd ever been on, to come back into my body.
And was that the spirituality part that brought you back into your body, or was that the therapy, or both?
Both. Therapy on its own was never going to bring me back into my body.
And that was even doing somatic therapy.
Somatic therapy.
Through the body.
I used every type of healing. I went on some real deep therapeutic journeys. But that wasn't going to be enough. I really needed to connect and feel that my body was on this planet.
Connect to something greater than your mind and your memories and your intellect.
Because my mind would take me back into abuse. That's what complex PTSD is. Reliving the abuse. But my body needed to connect with nature and needed to feel. But that hurt. And this part of my journey, which again I've done with my children in my life, and again in a marriage which hasn't survived, has been the hardest. I'm not in abuse anymore, apart from really kind of the reliving what I was doing to myself, which is I don't deserve to feel. I've not been in an abusive place for a long time. Yet this last 2 years has been the hardest part of my 6 years on this planet. Because it would have been easier to never feel again. And sadly, for many trauma victims, that's what happens.
I was going to say, you can understand why so many people don't go there, don't do this work.
I agree. And I think, do you know what really gave me the knowing that I had to do it, is the honour of working with so many people in the end of their years. I specialise in oncology.
Cancer.
I have shared people's last chapter of their lives on hundreds of journeys where at some level I've been a part of their, leaving this planet, fighting to stay, but sadly leaving children too. And I think having really, years ago, sitting on my bedside cupboard was Regrets of the Dying, which I've read on several occasions. And actually really watching people prepare themselves for the end of their lives. This life is so precious and so short. And none of us know when it's going to end. But I knew for myself, for my 2 girls, and actually for all of the other trauma victims out there that have gone through whatever level of trauma that they've experienced, if we don't do the work, there will always be a level of regret.
That was the message I got from you from early days, was actually there was a strong part of you that really wanted to step onto that path of truth.
Yeah.
You didn't want to keep pretending anymore. Because actually you were in quite a comfortable kind of cycle, really, weren't you, when we met?
Oh, completely. I thought life was absolutely perfect.
Workloads and just go through the motions every day.
I had a nice
keep
house.
The lid on, keep the
I had
mask
2 beautiful
on.
children. Why would I want to compromise that? That's the ease of not doing the work. For me, that was the ease. But it wasn't authenticity. And I knew that I wasn't being truly authentic, but I didn't know how to reach it. And did I even want to reach it? Because I knew that to reach it would be painful. And it wasn't even a conscious, I didn't wake up one day and go, right, we're going to become authentic now, Jo Gamble. It didn't work like that. Like I said, it became kind of a rebirth story. And then I was in labour. And unlike my real labours that actually, I hate to say this, didn't really hurt.
Yours were quite easy.
They were both easy labours, both done without pain
in your life.
Indeed. Unlike my real labours, this was painful. And I had to feel that pain. And what I've been incredibly blessed with is some amazing friends around the world. I've been blessed with some amazing therapists and coaches. I've been blessed, I would say, with guides in the invisible world as well as guides in the visible world to hold my hand and to support me through this journey, which, like I said, has cost me big.
I know.
But I've needed to do it to truly show, initially, my own children, how worthwhile that they are, how precious they are. But I wasn't being authentic to them because I was telling them that they were worth it, but I never believed I was worth it. And actually, as my daughter went through her own kind of older years and young adulthood, I felt she saw through my mask. And therefore I felt that I would jeopardize that side of her. And of course, then my younger girl as she gets older.
So setting the right example as early as you can, you mean?
And as I've been through this personal journey, which I did just for me, I did this to connect me and feel this physical body.
Reconnect you, to put all those pieces back together again, because actually, as someone who's been through such huge trauma, because like you say, it wasn't just the childhood trauma in those childhood years, it was teenage trauma, and there were some other traumas along the line, including your daughter becoming very sick as well. So much trauma you carried, to then be able to actually thrive in a significant aspect of your life, which was your working life. You know, becoming financially independent and successful, as well as with your work and helping so many people. But bits of you got left behind.
Completely, huge bits of me got left behind. And this journey, which I spent maybe 5 months of this 2-year journey in permanent flashbacks, where every night I would go to bed and I would relive the memories. And that was hard. And I knew I couldn't reconnect with the old tools that I had used. I couldn't reconnect with self-harm because I knew it would be a slippery slope that I might not pull back from. I'd long since given up alcohol. That's long gone out of my life. So I couldn't numb. I'm blessed that I have saved myself from that anorexia journey. I've turned back my osteoporosis diagnosis to a normal bone density. I have healed my heart, but I started having periods again, went on and had another pregnancy, albeit with IVF support.
So having done a lot of this deep healing work, having worked really hard to put so many of these pieces back together for yourself, what does that look like for you now?
I think for the first time ever, what that looks like, and there's no full stop to this, there's no end, there's no done, there's no complete. What it looks like is really reconnecting, or connecting. I can't even say reconnecting, because re means it's been there before. Connecting with myself and learning to parent myself like I was never parented. So I've done a lot of work with a coach around about the inner child and about being the mother to the inner child. I know how to parent. I'm not saying any of us have got it perfect, but I know how to parent my external children, but I couldn't parent my internal child. This is one of the biggest blessings of my little true spirit that came into the world 4 years ago, is she allows me to parallel mirror parenting her and parenting my inner child. And a lot of my deep visual work, my spirituality has taken me very visually into mindfulness and meditation. And as I sit there with one little girl on one knee and the other little girl, my inner child, on the other knee, and in being the parent I want to be to my real child, I'm learning for the first time ever, because I wasn't ready for it when Georgia was little, but I'm learning for the first time ever to parent my little child alongside her. It's the joy of and the gift of my children is showing me how to parent me.
Yourself.
And for the first time, kind of self-love and self-compassion and self-awareness and loving myself through being in this body and nourishing this body and caring for this body and connecting.
And let's look at the tools you've actually used on this journey, because you've done energy work, you've done somatic work, so predominantly emotional freedom technique. You did a long time with that, didn't you? Really going back in time, releasing the emotional charge from the past. So that was a big part of what you did. And you've also looked at the mind-body connection through German New Medicine. So when the concept of German New Medicine being when we have significant emotional conflicts, they actually can manifest through physical complaints as well. So you've done a lot of work on that. And you've also done the spiritual side as well. Lots of really deep meditation and different practices. And experiencing that different version of yourself. So experiencing yourself on a different plane of existence almost. And of course you've done the mindset work. You know, which is an eternal practice, you know.
It's an eternal practice, and what I would frame the mindset work as is rewiring the brain, the neuroplasticity, and there will never be an end point. I mean, I think I'll be in coaching for the rest of my life, and I'm okay with that. I'm proud of that. I'm accepting of that. So for me, therapy started with looking in the rearview mirror, looking at the past. I've done that. I've seen it all. I've relived it. I'm okay with having seen it, and now my focus is on the looking forward. That's more where the coaching, and I've got some amazing coaches in my network, everyday, every week existence. But actually the biggest gift I can give to myself is my spirituality and my connection, because that allows me to really come back into my body when I fly off, which I do really well. I fly off, you know, and that's where the history of anxiety, but the history of going into the brain and the what ifs and the what coulds and the what shoulds happen. And I have to come away from the ifs, coulds and shoulds and really reconnect. And the only tool that has ever allowed me to do that is my meditation practice and my connection with kind of my soul. And again, that's not something that we learn or we teach or
it's not
medics.
It's a bit of a taboo.
It is a bit of a
in our
taboo.
Culture.
And it's that side to it, this whole journey that has really developed me as a practitioner. That has taken me to the next level. Because like you said, I was pretty well respected at the level I was academically. That's my left brain, and I'm a very left brain, or how I have been described as a very left brain girl. Somebody wants to do research and understand their nutrigenomic pathways as to why we behave the way we are, or why our bodies behave the way it is. I'm the girl to give you the answers to that. Yeah. But actually what spirituality and neuroplasticity and coaching and connection and my soulful journey has brought to me is the right side of my brain, which for the first time ever has made me whole. Because I was, the next masters, the next letters that was developing the left side.
The overachiever.
Yeah.
Even though you always thought you were stupid, actually, you went into complete overachieving, which isn't uncommon, is it, with a trauma journey?
But it was another form of self-abuse, wasn't it? The
push,
overwork,
workaholism, and drive yourself so hard all the time.
But it's way more socially acceptable. So it wouldn't have looked good picking my daughter up from school and saying, hey, I self-harmed last week. But yeah, it absolutely is socially acceptable to say to people, I work 17-hour days, I am managing on 4 hours sleep, I will...
People go, wow.
Yeah, people look at you in awe and think it's amazing. And I'm really having to learn that that's not the amazingness that is
that's
me.
Hard conditioning to break, isn't it?
But the reconnecting, the whole like mind, body, soul journey for me is the biggest thing that I could do, not just for me, particularly for my children, but also for everybody who walks into my office. Because that is my true authenticity. It doesn't mean I tell everybody my story. What it means is people feel me through the work that I do.
And actually, I feel, having watched you go through this journey, I feel that it was the spirituality, that calling to truth and your essence, and reconnecting with your essence, and the connection with the what that you are, that bigger aspect of what you are rather than just our minds. That was the thing I feel that kept pulling you forward, kept driving you towards it. I think if you had just been left in the realm of psychotherapy and the mind, I actually don't feel you would have.
I would never have healed.
Yeah, the spirituality, connecting with something greater than yourself, and the thing that connects all of us. I feel that was the key aspect for you to keep trusting and allowing you to put that next foot in front of the other.
100% agree. Because believe me, at 3 o'clock in the morning, the brain can do some pretty crazy things to you. Back into that coulds, woulds and shoulds.
Which came from your fear. You had a childhood steeped in so much fear.
Yeah.
So your brain grew and developed in a state of fear.
And that fear remained in every cell of my body. The concept of the body holds the score. Now, I've generally been blessed with a relatively well physical body. I actually don't know how, but I'm blessed. But again, through this journey and through some physical processes like frequency medicine, which is kind of bridging again the physical to the energetic realm, I felt that fear released from my body. And as it's released, it's brought a lot of tears with it. But that is the body holds the score. I held on to that trauma in every cell of my body.
Whereas the spirituality, when we connect and we meditate deeply and we go into that state of peace and connection with all that is, there's actually no real place for fear in that, is there?
None at all.
So you experienced a different level of existence within yourself through spirituality.
And the beauty for me of that side of me is I take it with me wherever I go. I'm through deep practice, I'm able to very quickly now reconnect. So whether it's in between 2 consultations, whether it's when I'm stood at the school gate, whether it's even when I'm driving, I can reconnect. And that is the biggest blessing. And at times when I use the word depression, I really felt that darkness. I asked you, should I be on medication at this point? Do I need to medicate to numb this feeling. And I managed to avoid medication. For me, that felt like the right thing to do. But the only reason I managed to avoid it was connecting. So for this journey, I am incredibly grateful. I'm grateful to the therapists and coaches who've supported me on my journey. I'm grateful to my children. I'm grateful to all the friends who have been a part of my journey. To both of my marriages, I'm eternally grateful because they've both supported me through a huge, huge journey. And just because they haven't survived, that doesn't mean I'm not eternally grateful for them being on that journey with me. And like I said, this is no full stop. This is no end. But this is a journey I'm now proud to call mine.
Amazing, Jo. You know, it interested me when you said earlier, because actually you've never said this to me before, that you see yourself in coaching for life. And that really surprised me because I haven't seen it like that with you. I've seen you've learned so quickly. You've moved through different stages and levels of yourself, your being, and your healing journey so quickly. You're an incredible teacher to others, you know, in the craft that you offer. And I certainly hadn't seen you in coaching forever.
Well, maybe it's the accountability that coaching brings me. Maybe it's that little bit still of, can I do this on my own? Belief.
I know
so maybe
you can one day.
Maybe it's a limiting belief that I need that, as opposed to I actually have my tools, and that doesn't mean that it's not a challenge. You know, this life is hard. We're not here for ease. So we all need to create this kind of therapeutic toolbox. And I have a pretty big toolkit. And just like I say, in the functional medicine world, you know, we need to use our tools of the trade. In this journey, I've needed big tools and big support. And that's why I'm so blessed.
And we need to practice it.
And we need to
saying.
practice
what
it.
we practice.
Yes. And I suppose maybe why I was saying that to you is it's that accountability to remind me to use my tools.
We need reminders. Yeah.
But it's you know, right now, every time I feel those feelings, the big feelings, as I say to my 4-year-old, oh, you've got big feelings. We've all got big feelings. We just don't name them as big feelings. Every time I feel those big feelings, I have 2 choices now. And I'm much more aware of where I take those choices. Choice 1 is to go back into the brain, to overthink, to overanalyze, to overquestion, to overjudge. Choice number 2 is to use my tools to really connect, to ground, to be grateful, to meditate, and
check your mindset.
Yeah.
Where's the self inner critic, the strong inner critic?
And sometimes, as you know, I need to use an external person to remind me to go for choice number 2, because the default for all of us, but particularly for somebody who's got such an analytical mind, is to take the first option. The brain option. But the brain option never gets me out. The brain option never gets anybody out of there.
Perpetuates the spiral, doesn't it?
Adds to it. So sometimes it's like, reach out to somebody and go, where's my options? Just to be reminded. So maybe it's not coaching, it's connection, it's community, it's
the spiritual practice.
It's the love, it's the
And actually community is really important on this journey. I mean, in spiritual traditions, we talk about the spiritual community being essential for someone on a spiritual path. But likewise, on a healing journey, which is part of the spiritual journey as well, actually it's so important to have people around us that really actively support our healing, the choices we make, and also can serve to remind us. So I suppose maybe what I could see for you is maybe in times of, you know, life always happens.
Of course it does.
Life events, life struggles, life challenges. So the next life challenge, that's actually when you might need some reminding, like all of us, some reminding of the tools that you have. Because when the wiring, the wiring of the mind from childhood, when it is so unbalanced, you know, you were never taught how to think.
I never got the right wiring from the beginning.
Exactly. So when it was all just in this place of fear and survival, then when life challenges and the external pressures and stressors come along, it's very easy to go back down that path that you knew for decades. So to be reminded to come out of that and have the confidence to utilize your tools. Yes, I agree. Accountability, some reminding as well. But yeah, we never get taught how to think. No kids.
No.
And our children are at the mercy of what they are being taught by their parents. How their parents think, that gets passed down, unless you get actively taught how to think by a coach or something like that. So you're lucky if your parents think well or think poorly, helpful thinking styles or unhelpful thinking styles. So many people's parents had unhelpful thinking styles, so they were just at the mercy of that. So then we have to relearn, which is what you've had to do.
Yeah.
So what would you say, Jo, to someone who resonates with what you've been through, someone who may be sitting there watching you now going, I've been through so much of this and I haven't spoken about it, and I've lived in guilt and shame and kept it to myself and been very quiet and hiding and keep that mask on for my safety, for my survival. But maybe Jo's done it. Maybe I can do it. Maybe I can be brave. Maybe I can go on a therapeutic journey. What would you say to that person? Because it's a big deal.
It's huge. It's absolutely huge. And I think you need to pull together that support around yourself, whether that's family, whether that's friends, whether that's therapists, coaches, whether that's, external communities.
Find your team.
Find your team. That has been the only way I've survived this last 2 years, is to have that team of people that have been with me every step of the way. And nobody can do that journey for you, but you can't do it on your own. You need people. And that's what I've learned, because I was so independent. I thought I could do it on myself. I thought I could intellectualize myself through that healing journey. I've read so many books. I've done so many workbooks. I've done so many courses, but that just fed the side of me, the option one. I needed the community feel to really help to connect.
And these other kind of body tools and the spirituality and these other aspects of yourself as well. So what if someone doesn't have that support? Because obviously a lot of people who have been through a lot of trauma, like yourself, haven't got the family support.
No.
And so it's quite hard. And maybe they haven't created healthy relationships around themselves for that reason. So I suppose it's not to put people off starting a therapeutic journey.
What I've learned is a therapeutic journey hasn't got an end point. No. I've seen my journey like peeling an onion. I took off the hard outer shell and I cried. And then I took the next layer off and I cried a lot. And I've peeled and I've peeled. And that squidgy middle, that stings like hell. So, but I've not done it all in one go.
No.
And it's okay to leave the onion, and then come back to it later on when you've wiped away the tears. You don't have to do this all in one go.
Certainly not an overnight fix.
It's not an overnight fix. This journey for me has taken years, but particularly the last 2 years have been such a huge journey that like I said, I feel blessed to have been on.
You were ready.
I was ready.
You were ready, and you quickly gathered your team around you, and you just had a pulling towards it, didn't you? I know a lot of the therapists that we work with in the clinic, they will always check with a person that's starting on the therapeutic journey with them, what's your support network like? And if they haven't got anyone around them, that therapist is going to go very gently, very slowly.
And that's still okay though.
Yeah.
It's still okay, however many small baby steps each and every person makes. No trauma journey, however big or small your trauma is, no trauma journey can be rushed. And I think that's the bit I want everybody to be aware of, is baby steps all still count.
It's amazing. Jo, thank you so much. I always knew your story would help so many, and I just know through having heard you today that so many people watching and listening are going to just be feel it so deeply within themselves and be in awe and feel so inspired by what you have been through, not just been through and survived, but actually thrived through. And then beyond that, done even more of that deep healing work to pull the rest of those fragmented pieces of yourself back together again. So I know your story is going to offer so much hope and inspiration to so many people. So really, from the bottom of my heart and on behalf of, I'm sure, so many people that are watching, thank you so much for being so brave, so courageous throughout your whole life and on this healing journey, but also today to actually come here and share with the world so everyone can benefit. So thank you so much. Thank you, my dear.